According to a new study led by the scientists at the West African Center for Cell Biology of Infectious Pathogens, WACCBIP, in collaboration with the Noguchi Memorial Institute for Medical Research, NMIMR, around 20% of people living within the Accra and Kaswa areas may have been exposed to COVID-19. Physician and lecturer at the School of Public Health at the University of Ghana, Legon, Dr. Justice Aheto, believes that special at-risk groups are most likely to be affected by the virus due to the people's constant and erratic movements within the market centres. He opined that they will continue to be exposed to the risk if special interventions are not given to them.
We need to be sure that there are specific interventions tailored towards the market women. If you remember from the start, there was this issue about getting the hand washing bowls and then these kind of soaps and sanitizers in our marketplaces and our loading stations. Today, as we are speaking, please go back to those places and see how many of them have these things. So if the government is very much aware that these are special groups, they will have every now and then go back to those markets and get those things for them. How much does it cost to get this the water tankers, or to get the soap or the sanitizers for this special group of people?
The study by WACCBIP was conducted in public places, including municipal markets and lorry stations in Accra and Kaswa, shopping malls in Accra, COVID-19 testing centres and other research institutions and health centres in Accra. The scientists believe that the results of their studies provide evidence that COVID-19 is not in decline, as current daily confirmed cases would suggest, but rather that it is on the rise and spreading in our communities. The majority of the study's participants work in the informal sector, many sampled from markets and lorry stations. When the GH1 TV news team visited the market at the Tema lorry station, we saw that the informal workers in the vicinity do not consciously adhere to the COVID-19 protocols. Some of the market women went as far as expressing their disbelief in the existence of the virus in Ghana.
Emma we okay, but na kakra pe na hometi ye yin kakra na ye hometi yen nti wo hye kakra ne wayi ba wuti wosi a wo ye free nti na ma ye ntimi hye no.
Corona no mean to me who say we around still, but me who say am for a share nose mask no, but anti say first ni there no be a share, but say see there e mo aju kakra nose mask ni ato e say ye ni sika beto say ento ade akufado why lockdown ma yento adntimi so yento asana say yento nti minister beto nose mask oncheche nose mask no odegu fina o se amuye campaign amuye ni na amunche nose mask etimi so ma chenye boni
nose mask no tam na corona ne ba ya hye sa edu tam be a me hye amakuma bon se na ebo ni se enti afede ebe hu se corona no yesi ebi abagana but still ye hu do mo yare no because corona na broche ba yo no ma yo TV so ye hu se corona ni de o bagana de ni ye hu se reach hospital na ewo se 30 service se kwalebo ye hu bebe ewo enti se nose mask ni ye hye so obi beto ade o si obi beto ade kura na obi sane so obeto anya obeka wunti de oka ti na se ya ja hye.
I'm sorry pe na mi di ko na mi fa mbajom e say yare nu de mi ye kan say yare no wo pa na mi share down obi ati say ye wa yi pa say corodious no wo ho a anka say ye hu wa ha pa enti mi de say yare nu mo de nyame anim mi njindi mo enti mi de mi fa ni serious.
Physician and lecturer at the School of Public Health, Legon, Dr. Justice Aheto, is of the view that we are not getting the needed data to manage the virus.
When we get some idea about how the rate will look like, we know how to strategize ourselves. So right now, I wish I could get a data that I can use to even inform government as to what are critical risk factors as far as COVID-19 is Ghana and how the rate is looking like around the country. You can get that data. My dean here, Professor Fubel, wrote a letter. I'm part of that team to Ghana Health Service, to government. Still, we are sitting here, even to negotiate. We are sitting here, we don't get that data. So, why do you want to inform the process? And listening, without data, we can move forward in this country.
As we are still in the COVID-19 era, it behoves on everyone, including informal workers, to ensure they keep things neat and hygienic so that they and their customers are kept safe and protected from COVID-19. Nanama Anabempong reporting for GH1 News.